Hello, everyone. Today we're going to talk about therapeutic communication. So, the objective is to understand the importance of therapeutic communication in a healthcare setting, to understand the awareness, to discuss the factors that influence ineffective therapeutic communication. We'll describe communication techniques and use them in specific situations. Differentiate between ineffective and effective communication. And identify communication barriers in therapeutic communication in healthcare. So, what is therapeutic communication? Therapeutic communication involves good listening skills, patient-centered communication, so we focus solely on the patients. It's essential for good quality care. It promotes a greater understanding of the patient's needs and concerns, and it helps the patients to express their feelings and their concerns, and also to explore their thoughts. The importance of therapeutic communication in healthcare. It gives you a chance to establish a connection and a trusting relationship with your patients as well as your coworkers. It allows the healthcare professionals to provide holistic care. Also helps to improve overall well-being, and helps to build a rapport and strong relationships. So we're going to go over a few of the techniques. We are also going to talk about what are the 5 C's of therapeutic and effective communication. The first one is clarity. Number 2, conciseness. Number 3, confidence. Number 4, completeness. And courtesy. First up is clarity, which is the foundation of understanding. Transparency, accuracy can improve a patient's safety. So let's look at an example. So if a patient is talking to you and it seems like they're having a bit of a difficulty getting their words out, you want to make sure that you are really actively listening to them. And your response, for an example, can be, so if I'm understanding correctly, you're feeling anxious about XYZ. So whether the patient has a procedure coming up, an appointment, or making a difficult decision about their health, you want to make sure that you're listening. And active and therapeutic and something that's very effective would be this sort of response. So if I understand correctly, you're feeling anxious about your upcoming appointments. You give them time to give you some feedback, and then another response would be, am I interpreting your concern correctly? Or is there more you would like to share? Because the whole point is you want to make sure that they are clear with you and you're clear with them. So make sure that you have your listening ears on and you listen in correctly and clearly, so that there's some clarity and there's nothing left that you have to piece together, because you do not want to ever put any words or assume when it comes to the patients. Next is conciseness. Conciseness is communicating complete information about a topic or an idea in just a few words. You want to make sure that you're keeping them engaged. For an example, let's streamline our approach to ensure everyone is on the same page. So we can put this into effect when we're dealing with our coworkers or the patients. So if you're talking on the phone to a patient or in the presence of a patient, you're not always going to agree on everything, but you want to make sure you're being concise to the point so you won't have to piece the things together. And you don't want to lose their focus. You want to keep their attention. So let's put our heads together so that we're on the same page. Patients are doing all kinds of stuff. They're on medication, sometimes on 2, 3, 4 medications at a time. Sometimes they don't want to take their medication, or sometimes they're just a bit confused. So that you're concise and we're on the same page, let's come together so that we can streamline this thing out. Let's come together so that we can come up with a better approach. So that would be an example of being concise. The next one is confidence. Confidence includes assurance, boldness. That means that you're believing in what you are telling to the patient. You're sure about what you're about to say. Boldness, you're bold about your decision. You believe what must be communicated, which is very, very important. That is a critical component in effective communication. This could jeopardize the treatment and healing process due to lack of trust between the caregiver and the patient. So you want to make sure that whatever you're conveying to the patient, whatever you're telling the patient or the family members or your coworkers, you want to make sure you have confidence in saying that. The next one is completeness. Be thorough. Incomplete information can lead to misunderstandings and confusion. So whatever information that you have to give out, make sure you're giving it out completely. You're talking to them in completeness, complete sentences. You're telling them everything that they need to know. And the last one is courtesy. Listen actively. Be mindful of cultural differences. We deal with people from all different cultural backgrounds. So sometimes their accents is a little bit heavier than some other cultures. And sometimes they may not be speaking as clearly, so you want to make sure that you're listening correctively with your your listening ears. So you want to make sure that you are actively listening and you're being mindful of those cultural backgrounds. Treating others with respect, empathy can create a good environment for effective communication. So we're going to go over a few of the techniques. So listening, this is one of the most important techniques in effective and therapeutic communication. Active listening. There's a difference between listening and hearing. You can hear something on the bypass, but are you really listening? Are you really hearing it? Are you really listening to the message that's being said? Active listening, we go by SOLAR. S for sit facing the client. You want to make sure that you are having eye contact with that client. The O would be for open posture. You want to make sure you remain open. You don't want to lay back. You don't want to fold your arms. You want to remain open. L is for lean forward towards the patient, because that's telling the client that you're interested. They have your attention. You are listening to them. You are hearing them, and you're interested in whatever they have to say. You don't want to lay back. You don't want to slouch down in the chair. You want to make sure that you remain sitting forward. You have an open posture, and you're leaning forward, engaging in the conversation. E is to, again, we talked about establishing that eye contact. Make sure you keep that connection with them. And then R is for relax. You don't want to be uptight. You don't want to sit at the edge of your seat, because they can feel that energy and they can see it. So you want to make sure that you're relaxed. That also lets them know that you're engaged in that conversation. So again, active listening. Solar. S is for sit facing the client. O is for remain open. L is for lean forward when talking to the client. E is for establish the eye contact. And R is for relax. And be sure that you're open to listening to what the patient has to say or the client has to say. And it's okay to have a bit of humor. Humor can change the energy in the room. You just have to be careful, again, with those cultural backgrounds. You don't know what may be funny to one person may not be funny to the other person. So you want to make sure that you're not always uptight. You include some of that humor in there, but also be mindful of those cultural backgrounds. So here we're going to go over just a few of the examples of therapeutic communication. So we're going back to that active listening. Remember, listening is one of the most important ones. So an example would be, I hear your concerns. Let's discuss how we can address them. So you have a client that's calling you on the phone, or you can also use this with coworkers or employers or employees. You can also say something like, if they're talking to you and they're expressing a concern, I'm just frustrated. I'm frustrated. I have this pill to take. I have that pill to take. Oh, my check didn't come. This or that. Make sure you are actively listening. Let them talk. Then you can respond calmly. Okay, I hear your concern. So let's discuss and see how we can address them. This is boldly engaging in conversation. The next one says, I can see this situation is challenging for you. I'm here to support you. This can be a great way to communicate in the workplace. You have a coworker that's overwhelmed with something. They're expressing their emotions. Be listening ears. This will demonstrate understanding. I can see your situation. By you telling them, I can see your situation is challenging you, that directly tells them, okay, she cares or he cares. I can see this situation is challenging for you. I'm here to support. This is demonstrating understanding. The next example we're going to look at says, can you elaborate on how you've been feeling lately? This is an example of an open-ended question. An open-ended question gives you a chance to engage in a dialogue with your client or coworkers or employer. It shows that you're encouraging them and you're sharing, something with them. So asking an open-ended question gives them time to elaborate on what they're talking about. Can you elaborate on how you've been feeling? It shows that you care. Another example of therapeutic communication. It seems like you're feeling overwhelmed. Tell me more about it. You're dealing with a coworker. The coworker seems frustrated. Most of the time, it has nothing to do with you personally. We all go through things in our life as well as in the workplace. So you always want to make sure that you have an open mind when you approach when you encounter these kind of situations. It seems like you're feeling overwhelmed. Tell me more about it. This doesn't just cater to clients or patients. This can be your coworkers, your employer, or your employees. It's okay to give a compliment every now and then. Let them know you notice their dedication. It's making a positive impact. This is positive reinforcement. And it lets them know, hey, I recognize your efforts. The next one, let me confirm that I grasp what you're saying. This again goes back to one of the 5 C's, clarity. This is clarification. This is ensuring that, hey, I'm understanding, and if I don't understand, can you help me understand? Let me confirm that I grasp what you're saying. And then the last one would be, let's brainstorm together for a solution that suits both of us. This is a problem-solving collaboration that can work well with communication between 2 co-workers, as well as communication between the caregiver and the client. Next, we're going to talk about non-therapeutic techniques. These are things that you make sure that you avoid. Rejecting. You don't ever want to reject anything that a coworker is saying. You don't want to reject anything that an employer is saying or a client. You never want to advise them on anything. You don't want to request anything because it puts them in a situation to where they have to decide if they're going to protect themselves by saying no or saying yes. It just puts them in an uncompromising situation. You never want to belittle the feelings of others. Try your best to avoid phrases like, everything's going to be all right. Well, how do you know that? How do you know that everything's going to be all right for them? Or you're doing fine. That's something that you also want to avoid, because how do you know that I'm doing fine? That's like you're telling them how to feel, and that their feelings and their emotions are not valid. So that is a form of non-therapeutic communication. Or saying things like, nothing's wrong with you, or get over it, you'll be fine. This is something that you never want to do. These are forms of non-therapeutic techniques, and they are a big no-no. You do not want to do that. Therapeutic communication with dementia patients. So let's discover effective ways tailored to Alzheimer's or dementia patients. Non-verbal communication. This is so important. You don't always have to say something. Sometimes we struggle with finding the words or the right words to say something. But you don't always have to say something. You don't always have to speak. You don't always have to use words. We're going to have co-workers and clients with different capabilities. So nonverbal communication is something that's very important that we need to make sure that we talk about. And this involves sharing information without using words. This is using expressions, body movement, eye contact. Nonverbal engagement. Hold eye contact and offer a warm smile to convey empathy and understanding. Maintaining eye contact and smiling warmly can reassure the patient, making them feel valued. Repetition and reinforcement. Patiently repeat information and instructions to ensure understanding. Repeating the visiting hours helps the patient remember when they can expect their loved ones. You want to avoid corrections. When you're dealing with patients with dementia or Alzheimer's, You want to make sure that you never try to correct them. Sometimes they may be aggressive. They may repeat things over and over, and it's okay. You never want to correct them. You try your best to redirect them, like distract them with something. So the thing with dementia and Alzheimer's patients is that they may not remember something that happened yesterday. They may not remember something that happened last week. They might not remember something that happened 5 or 10 minutes ago, but they will hold on to a memory and a moment that happened maybe 5, 10, 15, or 30 years ago. So whenever they're being aggressive, or they feel like it seems like they're irritated, you don't want to be aggressive with them. You do not want to match that energy, because they don't know. They don't know exactly what they're doing. You want to try your best to distract them with a happy moment. You never want to use words like, do you remember? Because they don't. You don't want to say that. That's not an effective way to communicate with them. Instead of saying, do you remember? You reminisce with them. Whatever moment that they always talk about, Miss Sarah always talks about her daughter Linda. Linda may be gone, but she doesn't remember that. She doesn't know that. And so instead of correcting her, you try to redirect her and reminisce with her. Don't say, well, do you remember? Lisa's not here anymore. Don't say that. You reminisce. Didn't Lisa like to pick apples with you? Let's talk about that. You once told me that Lisa loved shopping with you. Tell me about that, and just listen to them. You'll see their faces light up. You always want to distract them with something else. Even if they're feeling aggressive about something, you have to use a method of distraction. That's the only way that you're going to have some type of communication with them. You want to make sure you're paying close attention to those verbal cues and nonverbal cues, and make sure that you're always showing empathy. You want to make sure that you're acknowledging their emotions. You're acknowledging them in the moment. You never want to cut them off. If they're saying something over and over, you let them. You show them that you're interested in what they have to say. And once they finish saying it, then you can redirect them to a happy moment, something that they definitely remember. That's why it's important to develop that relationship with your patients, because you want to make sure that they understand that you're there for them. Last week, Miss Sarah was constantly talking about her tree that she planted years ago. Okay, you should take note of that, because that's a happy moment for her. So you want to make sure that if she gets agitated, let's talk about this tree you planted. Things like that. Even with dementia and Alzheimer's patients, you can still use open-ended questions as a form of communication. Just be there to listen. Ask them questions. Give them time to answer those questions. That's another way to develop that relationship, because that client may be a bit combative with someone else, but with you, they're not. It's because you've shown them that you care. You've shown them that they should not be afraid, and you actively listen to them and let them have a chance to respond. You can use forms of touch. Touch conveys warmth, caring, comfort, and understanding. You don't always have to say something. Just be there. Lightly touch them on the hand or touch them on the back, and just sit there with them. Silence is extremely effective, yet sometimes it is difficult. It's probably the most difficult form of therapeutic communication technique, because We always want to say something, but silence is very effective and speaks volumes. Active listening conveys interest and caring, and it gives the patient your full attention. This just gives you another example of closed posture. So when you're having a closed posture, remember we talked about folding your arms or being closed. This can indicate hostility, unfriendliness, and anxiety. And sometimes it can kind of push clients away if they see that you're like that. So body language is everything in communication. The open posture that we talked about may indicate friendliness, openness, and willingness. Oh, they're open. They're willing to hear me out. They're willing to listen. They're interested. So these are all very important ways and just little things to help kick our communication skills to the next level. And again, we'll just briefly go over again like ways to enhance your communication. Share observations. Talk with your coworkers. Talk with your employers, your employees. Talk with the family members, the caregivers. Share your observations. They love engaging in healthy dialogue. Make sure that the patient is included in everything that involves the patient. Acknowledge their feelings. You want to make sure that they understand that I know your feelings are valid, and I'm here to listen whenever you're ready. Open-ended statements and questions. Make sure you're asking open-ended questions. Give them a chance to speak. That's the point of communication. You don't want it to be one way or just one-ended. You want it to be open-ended. Make sure you're doing open-ended statements. You're encouraging them. You're asking questions like, how was your day today? Did you have a good week? How was your weekend? These are open-ended questions because it gives them a chance to actually share some information. A closed-ended question in communication would be, do you like red? Yes, no. That's it. The conversation is closed. Open-ended, I heard you like the color red. Tell me about it. Why do you like red so much? You see the difference here? Open-ended question versus a closed-ended question. So you want to make sure that you're asking those open-ended questions. And socialize. You get to know so much about a person if you just ask questions and introduce yourself. That's it. And last, a way to enhance communication is to simply by communicating. You have to make sure that you are communicating. That's the only way communication is going to get better. And remember, the goal is to get the patients, your clients to engage in healthy conversation. Is to bridge that gap between the patient or the client and that coworker, or the client and that caregiver, because there's always a little small gap in between there. So you want to make sure you follow all those steps of healthy, therapeutic, and effective communication so that there's nothing left unsaid, and so that we can continue to provide the best holistic care that's caring for the patient's whole body, mind, and spirit. Because if your mind and spirit is good, that means your body should be good also. So let's make sure we are having those healthy conversations. We're using those skills so that we're communicating with the patients effectively, especially in the business of healthcare, because there's so much information that can be misconstrued. So If you have any questions, I'll leave my information so that you can reach out. But I hope this video was very helpful to you. Thank you.